Okay, it says you're live. All right, here we go. Cool.
Woo.
All right, fantastic. The Dog and Pony Show. All right, here we go. Hey guys, how we doing? Happy Thursday.
Yep, good morning.
Yeah, Dr. Jessica and Dr. Schilling here from Secoya Health, and we're here to bring round 2 of our DPC questions for you to help you understand what's in it for you, what you're going to get out of it, and why it makes no sense to keep doing what you've been doing with your insurance. So, we've just finished off on vaccinations, right?
Nope, we need to touch on that today.
Fantastic.
Yep.
So that's why we check in. So the question is, do we offer vaccinations?
Yep, and the answer is that we will offer guidance and support and make recommendations on what vaccines that would be appropriate for you. So if you're a traveler and you're going across seas, I can certainly pull up information and provide that for you. If you've got children that you want to have vaccinated, we can review the guidelines, and then we would just make a recommendation for you to go over to the health department or a facility essentially that has the vaccines that you're searching for the children. So yeah, but we can make great recommendations for whatever your needs are.
Absolutely, and that's what we're here for, to guide you along your path. Mm-hmm. As we mentioned in the first video, we're here to help you identify your health goals, what's going to keep you on the path to optimal health in the future, and then help you figure out a path to maintain that. So that's our role. If vaccinations play a role in that for you, we're happy to provide that guidance as well. Mm-hmm. All right, so what is your policy on controlled substances? Because in our short time with DPC, we already have one question about that, and so I'll let the doc here answer that question because that's her expertise.
Yeah. So we actually will work with you, as we stated right away, that we are a judgment-free facility. So when you come in, we like you to be open and honest about what you're using for medications and treatments, but we also want to work with you for healthy alternatives. And so, for example, if you're on controlled substances to help with sleep, for example, we want to work with you to identify healthy ways to wean off. We've got some great recommendations. Same if you're somebody who's got chronic pain. We've got a lot of great holistic approaches here, various modalities that otherwise aren't available at other health clinics. And we don't expect that you just stop abruptly, but we want to help you transition because we know that it's unpleasant otherwise.
Right, and it can be dangerous because people tend to lose their minds when they go off. I have no pain. I can't control my pain.
Yeah,
right?
yeah.
So yeah, whether we're using Synexus or Pulse or nutritional supplementation or brain balancing and things like that, the things we bring to bear here for you can help you overcome your issues and make sure you're never dependent or reliant on those to manage your pain or your sleep or anything like that. Yeah, fantastic. All right.
And then if I enroll as a patient of Secoya Health DPC, when does the billing begin? And so I would say that the answer to that question is after we do your intake exam, we sit down and we spend about 60 minutes with you where we really identify what your priorities and health goals are. And then through that process, we create a treatment plan, and then follow-up appointments. And then most individuals will go ahead and sign up for their DPC membership, just like they would a gym membership right after or before they leave that day. So
yeah, so when you come in for your examination, you're initiating care. You're saying, this is what I desire. This is the path I want to go on. I don't want to go back to managing my conditions or taking medications for my symptoms and things like that. So it's like I'm in it to win it. I'm committed to this path, and so the expectation is that I'm coming in for my examination. We're going to start on this process, and I'm never looking back because I know my best days are ahead of me. And DPC and Dr. Jessica and the team at Secoya Health are the people that are going to get me where I want to go and give me the guidance I desire.
Yeah. And we usually set up your follow-up appointments. If you're an individual who has goals that you're working on, we usually set that up on that same day, so we kind of know where we're headed as well. So it's really helpful.
Right. And if things like blizzards come up, or you happen to be taken away unexpectedly and you're out of town, we do telehealth.
Yep.
So we have accessibility options that fortunately decades ago they did not have. We have it now, and that gives us every opportunity to serve you at the highest level and get you the guidance you need.
Yeah.
Okay, so the next question is, can I afford this? And I would say you cannot afford not to do this, because the level of opportunity here for you to feel better and get the care you need has never been more accessible. If you go on our website, there's specific information about the information you need, what's a family membership look like, what's an individual adult look like, what's a child look like, and so on and so forth. So absolutely, it's very affordable.
Yeah. Yep. Yeah, and I think, you know, the Blue membership, for example, starts at $87 a month, and that is super affordable. We talked about this and several other discussions about, you know, what would affordability look like for individuals. And if you're looking at what it costs to actually go into the clinic, how much is actually covered by your insurance when you go in without a deductible being met, you're often paying well over $100 for that first visit. And that's just one visit where, you know, you get unlimited visits with us for that $87 a month. So.
Yeah, it's, again, hashtag no-brainer.
Yeah.
Yeah.
Setting you up for success.
Absolutely. Yeah, and not breaking your bank in the process.
Right.
So, next question is, but I only visit my primary doctor care once a year. Is DPC for me?
Yeah, and I would say absolutely. I think there's a lot of opportunity that individuals don't get to have access to if they're not going in to see their doctor regularly. I think there's a lot of us who, you know, myself included, I would go in for my annual visit, and then in between I'd be like, okay, so I was working on diet and exercise and weight loss, but where am I at, and who's holding me accountable to that? And I think that's where, you know, my role is, and our care team would be holding you accountable for your end of the stick, if you will. We want to help you live your best life. So if you're working on weight loss and you've got a goal of losing 10 pounds, you know, the next 6 months, we want to hold you accountable. We're going to check in with you and see where you're at. And we do want to see you back in the clinic. We don't want to say, see you in a year, you know,
Right.
sort of thing. We do want to help be your cheerleaders. So
Absolutely. You know, a quote that we really love around here by Emily Nagoski is, wellness is not a state of being, it's a state of action. So it takes daily action. It takes the food choices, it takes the lifestyle choices, it takes the mental choices. Like what you pour into your mental factory determines what comes out and what your life turns into. And as a result, we really focus on taking action here and getting you the tools you need to take action on your daily life. Because it's not like, you know, the old days, I'll do a detox twice a year. I'll do one in the spring and I'll do one in the fall and it'll be fine. I'll be great. A detox is a daily thing. Like we're under siege from things in our environment and the level of stress we're under. And if we don't detox daily from the mental stress, the emotional stress, the physical stress, the biochemical stress, you know, things like that, toxins, you have to take action on a daily basis. So there is no better tool. That's why, you know, Secoya Health is on the forefront of all things in we call it wellness care, not health care, because if you stop and think about wellness or health care for a second, you have a connotation of like healthcare. Is it really healthcare? No, it's really disease management. So that's why we use the term wellness care, because we're keeping you well, we're maintaining your wellness, we're helping guide you, and then you're doing the work at home to make sure that you're accomplishing what needs to happen on the day-to-day, the month-to-month, the minute-to-minute, things like that. We'll give you the tools for that.
Yep. And then as you have questions, you know, we're just a phone call away. You can text us, email us. It's very accessible, and we love it that way too, for ourselves, our families, and we consider you guys our family as well. So
Absolutely. So we'll be coming to you with more lives in the future, more educational opportunities. Look out for emails, Facebook posts, YouTube posts here, as far as getting you more information, because this is not something you want to second guess. You want to take action immediately, because it's going to get you what you need and in a fast fashion, but it's also going to give you everything you need without, you know, needless drugs and surgeries and, you know, premiums and deductibles and
all the things.
So we'll sign off for now. Any closing thoughts?
No, I hope everybody has a great day, and we are accepting patients, so give us a call today.
Yep. So when you want to be a participant in your healthcare and drive your healthcare and get the healthcare you need, that's when you come to see Secoya Health and Dr. Jessica. And if you want natural healthcare on my side, we're available for that too. Brain balancing and things of that nature with QMRT and breaking neural patterns that are keeping you stuck where you are. You know, we're here to offer what you need. So let us know what you need. Let us know what questions you have, and let us know how we can serve you. All right. We look forward to seeing you in the next live. All right, guys. Take care.
Bye.